Welcome to another episode of DxTx Partners Podcast. I'm very fortunate today to have Dr. Ramis Gheith, our Chief Medical Officer at DxTx. He's also the president, founder, and lead physician at Interventional Pain Institute in St. Louis, Missouri. Dr. Gheith, welcome to the DxTx Partners Podcast.
Hi, Mike. Thanks for having me here. I'm excited to share a little bit about myself and share some of the interesting aspects of what we do here at IPI and DxTx.
Yeah, then that's exactly where we're going to start because I think you have a fascinating background on how you got into medicine, how you became a physician, why you
Yeah,
chose interventional pain. So
yeah.
give us a little bit of your background, kind of walk us through how you arrived where you're at now.
Well, years ago, when I was a child and being raised by a single mother with my mom at home, we were taught to treat each other with love and care. And it was a very loving home. And despite all the challenges that we experienced, and despite all the difficulties that come along with that kind of home, we were taught to work hard and strive for the best and focus on our futures and do it with love and care and with passion. And so I went to college and went to nursing school and had a wonderful time. loved nursing. Graduated and worked in the Cleveland area at Case Western University Hospitals and loved it. Absolutely loved it. I got to sit at the bedside of patients, holding their hands and talking to them about their disease processes and how we best care for them in the hospital as a nurse at the bedside. And I wanted to turn that healing, caring touch into more intervention and do more for the patients. And I decided at that time that being so young and in the field and having such a great experience that I wanted to do more. I wanted to learn more. And that's where I decided to go to medical school and finish a degree in medicine and went into anesthesiology. Uh, Loved the field. It was fantastic. Absolutely enjoyed learning more. I felt that I was bringing my healing capabilities now to my caring touch that I learned in nursing and bring it all together so that now I have the best of both worlds to care for our patients. And I absolutely love it till this day. It's my passion.
That's an amazing story. Walk me through a little bit about, as you chose interventional pain management, were there people early on in your career or throughout your career that were influential and a mentorship or people that you admired in the field of interventional pain management?
So we have a very small field, as you know,
Mhm.
and it's very common that you run into leaders, thought leaders, pioneers in the field. I had many of those folks, many interactions. Even till this day, I still meet people that I would consider to be great mentors. I want to emulate them. And so there are so many of them. But when I was in residency, and doing interventional pain management with Dr. Salem and Dr. Rafai at Illinois Masonic. I loved it and I decided, well, I'm going to take this to the next level and do a fellowship. And then I met some significant thought leaders in my fellowship, Dr. Kumar Bhuvanendran and Dr. Lubinel, who I still call today and ask for thoughts and decide some care paradigms with them, depending on how complex the cases may be. And they're still there. They still pick up the phone, and it's amazing. It's incredible. I'll text them, and it's really important to have mentors that you can rely on, ones that you can develop these long-term relationships with, and always know that if you call, they're going to pick up the phone.
And just to be, specific, you're talking about Rush. You did your fellowship at Rush in Chicago, correct?
That's correct. Yeah, I went to the Rush University Medical Center in Chicago, where I did a fantastic, phenomenal fellowship. one of the best in the country at the time, for sure. Highly interventional, very surgical, and really taught me the basic skills and more advanced skills that you need to be one of the leading physicians in your field.
Kind of the progression throughout your career. I'd love for you to talk about just kind of what you do and how you view leadership in starting your practice, growing your practice to the premier practice in St. Louis, one of the
Yeah.
premier practices nationally. What makes what you do different than what you see in other practices?
Passion. Oh, you do it with passion. You do it with love. Do it with the sense that this is what you're made for, so that when you wake up in the morning, you're not complaining about how early it is, but you're excited to get in the car and go see your patients and have that privilege to be able to care for those patients on a day in, day out basis. And do it with a smile, do it with the enthusiasm of day one. I've never, not once, said to myself, "Why would I choose this field? It's this field was made for me, and I was made for this field." And to be at the top of your game, most doctors, when they go to the field that they choose, need to really fall in love with it if they haven't already. This is your life. It's not a job. It's not something I call work. This is this is my life, and this is the way we all should look at our fields that we choose. And it's no different in interventional spine. Absolutely
Yeah.
love it.
Yeah, one of the things that amazes me, I'm gonna brag about you because it's some things that I see that are just unique.
Mm.
Regardless of how large your practice is, what responsibilities that you have nationally with DxTx. You're a physician that not only cares for patients, but you care for your community and making sure that you can touch as many people in the communities that you serve as possible. And Dr. Ramis Gheith will be out on the streets, knocking on doors, talking to referral sources face to face, handwritten notes, all the little things, those touches that show you truly
Right,
care. Um,
right,
and talk just a little bit about like what does your day look like when I know you have your really really busy days when you're in the OR and everything, but like
right.
on a Friday, what does a Friday look like for you?
Well, I tell you what, the days are mixed. They have a lot of everything in there, right? So I start my days with who am I going to email today? Who am I going to touch today? Where am I going to be more impactful today as opposed to yesterday, for instance? And what I do is I like to reach out to my doctors either through messages or emails, and then get in a car and drive over there and shake their hands and thank them for the referrals, answer any questions they might have about our practice, update them on the new technologies that we're bringing to the community, update them on the patient outcomes that they referred to us, thank them profusely for trusting us to care for their patients, whom they love as well. It's a one of those days, and then we go from that moment to a lunch, maybe a meeting over lunch at a practice where I sit with multiple providers and their staff, introduce myself to their staff. The staff is just as important as the provider. They want to know who you are. They want to know who they're sending their grandmother to. They want to meet you. And that's important. That's crucial. I often will then end with maybe a community outreach where I'm reaching out to the community and asking, what more can we do for the community? Is there an event coming up? Can we be at that event? Can we introduce ourselves to the community at large? And, for instance, last night was a great evening. There was a very significant event in Lincoln County. Lincoln County is about 35 minutes away from our office in Chesterfield, Missouri. Went up there, watched a livestock event for charity and auction for the 4-H groups in the community. The entire city, the entire county was present. It was amazing. It was an incredible event. We were there, we were present. We bid on one of their livestocks, and just to give back to the community, not to keep it for ourselves, not to keep it for me. I don't know what to do with the livestock, but but to give it back to the community. That's a typical day. It's all about being present and available.
Yeah, yeah. What a great example. One of the things that I think is unique, and I want to emphasize and hope is heard, is just kind of just three things: just the passion, the energy, and the humility. And I think that one of the things that in some practices, just that deference and that humility of serving the community, that comes through. And you see that with referral sources, very, very high patient satisfaction scores, great net promoter scores. So that thing comes through. So I wanted to stress that in some, you don't see enough of that, of just the
Yeah.
humility, vulnerability as you touch the community. So just a great, great story. Shifting gears a little bit, because that's a pretty good, overview of you and what you've developed in St. Louis. You're also in the role of Chief Medical Officer at DxTx and touching our entire network. We span from South Florida to Denver, Colorado, and many places in between. How do you view your role as the Chief Medical Officer in a pretty large and growing network?
Well, first off, we recognize that we have a great organization. That's first and foremost. And by doing so, you become the chief cheerleader for the organization, if you will. And the message I carry to the doctors that are and the providers that are in our network is that you're part of a great organization, and we're going to make it even better. And we do that together. We do that with enthusiasm, and we do it with the patient in mind being at the top of the list. Because when it comes down to it, yes, our providers are super important. Our patients are number one. And as long as we keep that in the mind of all the providers, and as long as our physicians and our providers, our nurse practitioners, our PAs are all aligned in that regard, we're going to have the best organization in the nation, if not in the world.
It amazes me the just the time and energy to be able to run your practice and then consistently any physician that calls, you pick up the phone and putting that touch on all the people and integrating that network so that there's a core exchange there, which is really, really neat to see. Outside of the DxTx network, what has you like excited about the next 2, 3, 4, 5 years in interventional pain management? And then I'm going to come back on the flip side and say, what are the challenges? What are the
Yeah.
obstacles that we're facing? But first, what has you excited? What's the good news?
Well, the great news is technology has advanced significantly, and we're able to incorporate that technology into the care that we provide to our patients for better outcomes, for more efficient care. We improve patients' lives, we improve their function, we improve their pain control, and that makes me excited. That makes me excited because their wins are our wins. And when we are able to incorporate that technology, it's wonderful. So we have a lot of new procedures that we could provide patients that are minimally invasive. Minimally invasive lumbar decompressions, for instance, being one of the significant advancements. Minimally invasive advanced neuromodulation, like spinal cord stimulation therapies, which have gone from basic TENS units to the most advanced therapies out there now in the world that we provide here at DxTx. Those technologies are being implemented to help patients regain function, improve their quality of life, get back to work, play with their grandchildren, you name it. We've seen it all. Patients who are 15 years old who have significantly improved their life, and we've seen patients who are 90 years old. Every patient win is a big win for us, and we love it. That's got me very excited. Technology.
How about the challenges? What challenges are we facing?
Well, with every new technology that comes out, with every new therapy that's presented in medicine, we have to deal with the lag in insurance recognition for those therapies. Those are challenges for our patients. It's often, I like to say that the system is designed to pin the physician against the patient or the patient against the physician, when in fact, what's missing, what the patients don't see, is what's in the middle of us, and that's the insurance carriers. And we have to advocate strongly for our patients. We have to fight for our patients to have these therapies provided to them in a timely fashion and encourage the insurance carriers to look at the data, because the data behind these therapies is robust. We have data that spans for decades in some cases, and yet still have a challenge in getting an insurance carrier to agree that that therapy is medically necessary for a patient. So those are our challenges. Other challenges include years later when the insurance carriers want to do a random review, if you will, and request a recoupment of funds paid to you for care that you already provided, for services that you provided already. Imagine how that would work in any other industry. It just doesn't make sense. Those are challenges that we deal with on a daily basis, but we fight back. We do it because it's our passion. We do it for our patients. We do it for our communities. We always fight back, and we won't lay down and let them run us over. Because the minute you lay down, the minute you give up, believe me, they're going to run you right over. And that's what they want you to do. And we just refuse to do that.
Along the obstacles, you have a really, really strong young physician coming out of fellowship that will be starting at IPI in the next month. But we also know that fellowship programs are a lot of these slots are going unfilled, especially on the anesthesia side, where they're choosing to just finish residency, go into anesthesia. What do you see kind of in the future, or at least the near future, with kind of a dwindling pool of fellowship trained physicians?
Well, there are several factors behind this trend that we're seeing. One of them, of course, being the compensation factor in anesthesia is just out of control. It's not sustainable. It will at some point level out or come back down to earth. But as I said at the beginning of this, and I'll continue to reemphasize this point, we do what we do because it's our passion. You recognize that it's your passion. So if you choose to do an anesthesiology job and move on in that field, that's great for you if that's your passion. You're doing this because you love what you do. You love your patients. And that's why we do what we do. Now, what do we do about this? Well, one, I think retaining the physicians that we have on staff is absolutely crucial. Supporting them, giving them the resources they need, showing them that there's camaraderie around the DxTx network, allowing them to reach out to you anytime they want, day or night. Call me, text me, let me know what your challenges are. Where I can step in, I will step in. Additionally, the new docs coming out, our new fellow that's coming out, I'm going to mentor him. I'm going to mentor him strongly, closely, and precisely so that when he's ready to run on his own, he's practicing at the top of his license with confidence, with love, with care, and with one person in mind, and that is the patient. And as long as we can keep that focus, we'll be successful.
Throughout my career, I've been to hundreds of practices and observed, what's going on, and a lot of similarities. Yours is different. And one of the differences in your practice is just the skill level of your APPs. And talk a little bit about your approach to APPs, how you use them, what makes it so unique that yours are just exceptional.
Well, it goes back to onboarding and expectations. And when we onboard and our APPs, we mentor them. We identify one lead APP who is able to take that role and mentor those APPs under her. Our APP, Mindy Wortman, is absolutely phenomenal in that regard, but that takes time to develop that. So you have to develop it from the ground up. And what we built was a foundation so that the next brick that goes on top of that foundation is stable. And the way you do that is you carry them along with you and you lead them from the front and you pull them with you. And you show them through example every day, day in and day out, how to treat a patient, how to examine a patient, what the algorithms are in order to hone in on a pathology for a patient. And I always say this, and I tell all the APPs in our practice, you know, you have three jobs here. The first job is to treat the patients very well, treat them with respect, love them, and care for them as you would your own family. The second job is to keep my hands busy and to keep us at the top of our game. Those are the three jobs that you have. And well, how do you do that? You recognize the diagnosis early on. You carry out the plan of care in conjunction with your provider, and you have huddles every day. You huddle, and huddles are important for the care paradigm. When a patient arrives, they know that the physician and the nurse practitioner or the PA have met. They know that they've discussed their care. They know which direction their care is going to go, and everybody is on the same page. And so that the plan of care that the APP provides to that patient is coming from the physician and the APP's collaboration. That's super important.
You mentioned Mindy Wortman. Those watching this, you will see a DxTx Partners podcast with Mindy Wortman because not only is she the lead APP at IPI, she's also the national lead for DxTx, and it's absolutely exceptional. So look forward to that in another episode. So one of the things that I find fascinating, maybe it's just because I'm a little bit older, but the way things are moving quickly, and then I've seen this AI avatar of Dr. Gheith, the avatar speaking Mandarin and German and everything else. What do you see as far as kind of in the AI landscape and how that might impact your practice and throughout interventional pain management?
Well, it used to be maybe even a year ago, someone would say AI, and I might think to myself, well, what is that exactly? But now we have a better grasp of it because we're incorporating that into our practice. We're incorporating that into DxTx. We're leading from the front across the country with AI. And that's going to be the game changer going forward in medicine. Incorporating AI in any practice is absolutely essential. If someone is not using AI, my first question is why not? We should all be using it. And one of the most impactful ways we've implemented it is through the avatar use, where we're bringing informed consent to the patients and we're giving them informed consent that they get to watch where it tracks their attention. So it monitors their attention and their understanding of the information that's being provided. And what that's done for our patients is that it's really improved patient satisfaction. It's improved patient confidence in the physician-patient relationship. And it's also improved your staff's understanding of what we're doing, which is absolutely essential. And all of that has elevated our game, and it will continue to get better as we move forward.
It's an exciting time, scary too, with some of it just like fascinates me. So I know that work is fun for you. There's not a time that I can't reach out if it's Saturday, Sunday evenings, early mornings. You're available. I know you enjoy that. But what do you do outside of just of being a physician and a thought leader? What else does Dr. Guy do for fun?
Well, I have a great family. I've got kids that are young. Take them swimming. Had swim party last weekend with the kiddos, and they had their friends over. It was fun. It was a great time. Go to movies with the kids and the family, and enjoy some downtime. Got to have date night with your wife. That's absolutely essential. So we have to have those. So we sprinkle some of those in through the weeks. So yeah, there's a lot of things that I like to do outside of this. One of the things that I enjoy that I wish I could do more is go to Top Golf and just hit the
Yeah.
ball, although it
Yeah.
may not be real golf to some people, but it's a great time. It's fun. It's a great time to have with the family as well.
Yeah. Yeah. I've been to
Yeah.
Top Golf with you. So yeah,
Yeah.
it's very, very enjoyable. What kind of like parting words? We'll have fellows watching this. We'll have,
Yeah.
people in our network, physicians, throughout the country watching this. Kind of what would you have to say of somebody like starting in the field, or even if they've
Yeah.
been in the field for a while?
I think that most people that watch this are watching it because they love the field. They're watching it because they want to learn more about interventional pain. And I'm going to tell you right now, the future is bright. The future is promising. The future of DxTx is boundless, limitless. I mean, we are skyrocketing, and that's the way we're going to keep going. And it's because we love what we do. So love what you do, no matter what field you choose. Make sure it's your passion. Do your homework on your patients, guys. It's one of the most important things before we get to see a patient is to learn about who they are. Learn who they are as a patient, yes, but as you review their notes, you begin to formulate this picture of maybe your mother, maybe your grandfather, and take that to the room with you. It's important, and it will only make you better. It'll make you a better physician, a better nurse practitioner, a better PA, and the patients will notice it. And the way you make them feel, they will always remember that.
Well, Dr. Geith, I cannot tell you how lucky we feel to have you as part of our organization, how fortunate I am to have you as a physician partner to
Yeah.
help grow our network and to touch our affiliates and our physicians. So thank you for
Thank you.
everything you do and very much appreciate everything that you provide for DxTx.
Thanks, Mike. I
All right.
absolutely love it. Thank you. Bye bye.
Okay. All right.